Hi, I'm Sarah. I'm a GP registrar in my first term and I'm based at Palmerston Super Clinic. I came to medicine a little later on in life. I grew up in Perth and slowly moved more and more into working in international development. Got into medicine, went down, did my medical degree in Adelaide and ended up doing the bulk of my training back in the Territory. And as I sort of moved through the hospital system, just became more and more interested in becoming a GP and signed up with NTGPE. The reason I picked them is I looked at the jobs that were available and they're jobs that you will not get anywhere else in Australia. The chances to work remotely with CDC and working with diseases most people don't see in their medical lifetimes, let alone every day, is incredible. So the Territory is a really addictive place. It's one of the most multicultural environments in the whole of Australia, both, I guess, in terms of working with Aboriginal people, but also in terms of the other populations that exist here as well. It's a huge privilege to be able to work in such a multicultural environment. It's a place where if you want to do something, you can do it. You've just got to decide to. And because it's a community that's has a lot of transition all the time, I think people are really open to inviting people in. You get to be part of a community if you want to, really easily. I'm never ever bored. Where I'm working at the moment, Palmerston Super Clinic is probably the second biggest health facility. When we need to go a step beyond the sort of services we have here, there's Royal Darwin Hospital, which has sort of the full emergency facilities as well as a small variety of specialty care as well. It's a pretty amazing place to be able to access help from when needed. The wealth of variety that comes through the door consistently is amazing. I don't know if someone with rheumatic heart's going to walk through the door. I don't know if it's going to be an antenate that's at 35 weeks, never seen anyone and has every high-risk feature known to man. I don't know if it's someone who's going to come in with a chest pain that's about to be a heart attack happening in front of me. And when I talk to people that train down south, and throughout my clinical training, whether it's been hospital-based or GP-based, it's the breadth that I see is not what they're seeing down south. I guess the Territory, it is different to the facilities that you do have down south, and I think as a health community up here, we've become really good at trying to work our way around the challenges, so whether you are based remotely or not. So we've got weekly access to small group learning sessions which are tutorial based. Here at this clinic there's always supervisors on call, and there's constant trialling of new ways to be able to access supervisors as well. What I really like about the supervisors I've met up here is that I've sort of found heroes again in medicine, which I haven't necessarily had for a while. So it's nice to meet people senior to you who are incredibly passionate and skilled in what they're doing, and to be able to access that knowledge base as well. So in a clinic like this one, there's a lot of registrars, which is great because we're bouncing off each other a lot. There's generally another 8 or 9 registrars on when I'm on. And so you are looking towards your senior registrars sometimes too to help you out when you're getting stuck. But we're getting together quite regularly, and when you're getting stuck, you've got a nice support network around that you can fall back on. So if you're trying to work out where you want to train and you want to go somewhere where you're going to have to take a bit of self-direction in your learning, but if you want to go somewhere where you're going to see things that you won't see anywhere else in Australia, you'll have opportunities to do things you won't do anywhere else in Australia, and you'll have placements that won't be accessible otherwise. Here is the place to come. It's an adventure. Every day is an adventure, whether you're based in a clinic in Darwin, whether you're out bush. Like, the whole journey will be an adventure with highs and lows, but if that's what you're looking for, it's a great place to come and train.